Hello everyone, how are you? So welcome to the Advanced Certificate in Practical Diabetology ACPD. We have formulated this small course under our Diabesity Academy. I'm Dr. Vishal Gabale. I've done MBBS, DNB Medicine, and I'm a member of United Diabetes Forum, American Diabetes Association, Indian RSSDI. I published a chapter. I'm a member of Association of Physicians of India as well, and Maharashtra Association of Physicians. But yes, apart from all this, I have a academic experience as well as teaching experience in the field of medicine as well as diabetology. And I'm a dropout of DM from CMC Vellore, and now I'm pursuing my clinical practice in Mumbai and focusing on the academic aspects because I love to teaching. Okay, so we are coming with this advanced certificate in practical diabetology, and I'm gonna here highlight that whatever things we will discuss over here in this course. So whenever the diabetology thing come in our head, type 1 type 2 diabetes, all the theoretical information that comes in our head, but nobody actually teaches key how to start treatment and what are the best treatment options for particular patient, or how to regulate that treatment, or if one drug is not helping, what other drugs to be added, or what are the updates, like SGLT2 inhibitors are there, GLP-1 receptor agonists are there. So that causes somewhat, you can say inertia in change of treatment, in taking courage, or taking a daring steps while managing this patient. You might be little less confident if you're not updated with the knowledge. So with that vision only, I've come up with this ACPD course. So the name itself I've given as a practical diabetology, okay, for a reason, because I wanted to focus more on the practical aspects, but it doesn't mean that the theory will be ignored at all. Okay, so not at all, theory will not be ignored. So here we have curated almost 8 to 9 modules for you. The one module is bonus over here. So in these 8 modules, whatever things we'll discuss, I'm gonna tell you forward. But before discussing all those things, I want to just tell that why diabetology learning is important in this era. Because see, here are certain numbers. In India, over 77 million patients are now with diabetes, and it is projected to be around 125 million in 2045. Right now, China is at number one, but I'm 100% sure that within the next 5 years, considering our lifestyle and all those choices people make, I mean, like, they have to work hard, and many people have inertia about taking treatment. There is so much of misinformation on the internet about diabetes reversal, and all those things are there, but only around 10,000 trained diabetologists are only available. So if you're a physician, you must create diabetes as your forte, and that's very very important. I mean, like, that's gonna make a significant impact in your clinical practice as well. Either you are an internal medicine specialist, or a pulmonologist, or a general practitioner, or any other specialty like obstetrics and gynecologist, or even a surgeon. If you have diabetology information or diabetology knowledge, or concepts are clear, I mean, like, that's gonna be a significant impactful for your patient, because there is a reason behind that. Diabetes is not a one organ disease, all right? It can affect any organ. I mean, like, literally, right from the significant increased risk of heart attack, strokes, chronic kidney diseases, blindness, infertility, in the wound healing in place of surgery, again obesity, a very important upcoming pandemic, right? Fatty liver. So all these things considering, even if you're medicine, GP, super specialist, endocrinologist, cardiologist, nephrologist, neurologist, anyone, you must know. Even if you're GP, you must know diabetes. All right, surgery, you still need to know diabetes even though you don't like it, because your patient might be having uncontrolled sugar, and you don't want poor wound healing for them. Your outcome might change. Similarly, in case of OBGY, gestational diabetes mellitus is very very important. Similarly, in orthopedics, ophthalmologist also, because diabetic retinopathy, nephropathy is very very common. All right, so we will discuss all these things, all the applied aspects, all the clinical aspects we're going to discuss over here. Apart from that, the future aspects like GLP-1, SGLT2, dual incretin, tirzepatide, what are the new things that are coming. Okay, so there are reasons that why this master class will be special. I have taken a survey on our Diabesity Academy WhatsApp group. We have a Diabesity Academy WhatsApp group. There I've taken a survey. I've asked all the students that what exactly you want the structure of this course should be. So they said that practical teaching should be there. Apart from that, they said that they want it in the recorded format. So we will keep it in the recorded format. There will be 9 modules. Okay, 9 modules. 8 modules will be for diabetes. One module will be for case scenarios. Let's be clear about that. Okay, 9 modules will be there, and you will have 20 to 25 questions each module. Okay, there will be 20 to 25 questions each module that you have to solve, that will help you to give you overview of the topic, and you will become confident. Apart from that, I have a very very special gift for you, that for 6 months duration we will have weekly one live session in which we will discuss cases, we will discuss treatment updates that are happening around in the diabetes. Okay, so it's a comprehensive, I mean, like, when you see the price about this class, nobody can just walk away. Everybody will feel that I must have this. Let me just go ahead. Right, so then most important step is certification. I know in this era you have to show certification, even in your clinic, in your practice, in your LinkedIn, social media. I want you to share this certificate with proud, because if you are studying this much, definitely your concepts, your ideas, your understanding about this topic is really gonna be at par level than other people who have not watched this. Okay, then the bonus is we have coming with the AI powered practice integration. I will share you how. So we have created a AI chatbot, as well as there is a AI transcript platform that I'm working on, medscribe, where if you just put your patient's detail into it during OPD consultation, you will get entire, I mean, like, you just talk with the patient, the entire conversation will be recorded, and that will be converted into the transcript. And that transcript will include not only from like their demographic data, name, age, sex, and all this information, because you have to talk about that, okay, with the patient. Then only the information will get recorded by that. I don't want to complicate, but I am just saying here that whatever you consult with the patient about diabetes, just turn on this recording, and then within next 2 minutes you will get the entire treatment protocol, how you want to give treatment. In that you can select, it's not like AI will give, you can manually select that. Okay, AI will suggest you investigation, then you just have to click. Okay, I wanted to do this 3 investigation. Then I will create a separate video about this also, about AI powered practice integration. Don't worry about this. Then you can select what investigation you have to do, what treatment you have to do. But more important that is, it will create a diet chart for your patient. Okay, it will create a diet chart. Sorry, I'll write over here so that it doesn't get hidden by me. Okay, so it will create a diet chart, it will create a exercise, more important is the exercise chart, that what exercises you have to do for that particular case. Then again, follow, etc., everything will be given. Patient will have a complete transcript of the consultation. So that's the bonus we are working on. Okay, so that's a bonus. Don't just get distracted by all these things. I know it can be a little overwhelming. And more importantly, I'm working on an online diabetes and obesity clinic. So there will be a quiz after 15 days since the course launches, and every 15 days there will be quiz. If you perform top top 5 people will be selected directly. It will be a placement, you can say, like a campus placement. They will work in our diabetes online clinic, where there are already more than 2000 patients regularly take consultations. Okay, so let's see now what will be the course like. Okay, now here I've added in the form of modules, like 8 modules plus one case based modules. So first let's start with this. Okay, so module 1 will be about the introduction. I will tell you that what exactly is there in all those different 8 modules. Okay, so you can see these 8 modules are there, right? So in the first module, I will tell you whatever information is there in the 8 module, the brief, overview of the topic, that this things are there, and this things you must know. Okay, then we will discuss about the epidemiology, that how much diabetes percentage in Indians and why genetic importance is there, etc., etc. Then physiology of the glucose, then because physiology is also equally important, you must know what is GLP-1 receptor, what is SGLT2 receptor, what are these different receptor where diabetic drug work. That's what physiology will understand. Then we'll learn the pathophysiology. Okay, that is also equally important. Then we will learn the insulin resistance, that how it changes the pathophysiology of the diabetes person. Okay, and then we will discuss that how diabetes gonna be one of the biggest chronic disease challenge in our generation. Okay, so that will be about the first module. In the second module, we'll discuss about the clinical features. Very, very important in your OPD practice. Never ignore the clinical features. Even though like 30% patient are asymptomatic, but whoever is symptomatic, you should never miss that. In which we'll also discuss the symptoms and signs, dawn phenomena, Somogi effect, what are the different phenomena associated signs, everything we'll discuss. Then coming to the classification, we will classify diabetes type 1, type 2, LADA, that is latent autoimmune diabetes, MODY, that is maturity onset diabetes. Okay, this is monogenic variation. These are polygenic diabetes. Okay, I will explain everything. Don't worry about that. Monogenic means single gene. Okay, so MODY, single gene defect is there. Then ADA 2024 diagnostic criteria we will understand. Okay, in the diagnosis, module 3 will be diagnosis and screening of the diabetes. That what exactly, sorry, okay, then module 3 will be diagnostic criteria. Okay, that what exactly is there in the diabetes, very, very important. Where what are the OGTT interpretation, what are the classification that we have kept for this, what is HbA1c accuracy, what is required, what is HbA1c first of all. Okay, all the investigation will be discussed. Then the normal protocol, standard protocol about this investigation. Then we'll also discuss about the CGM, continuous glucose monitoring, that how to apply those patches, whom to recommend those patches. Okay, all these things. Then we'll discuss screening protocols for eye, kidney, nerve complications, everything. Then we'll discuss about the treatment, that diet and lifestyle therapy, everything will be there. Then module 5 will be treatment 2. In first, we'll discuss about the treatment protocols, management goals, what will be there. Then what diet should be recommended, what lifestyle should be recommended, because that is equally important as compared to the pharmacological therapy. Then in treatment 2 module, in module 5 we are here right now, anti-diabetics and latest updates will be discussed. Anti-diabetics means about oral anti-diabetics. Okay, like metformin, DP4 inhibitor, SGLT2 inhibitors, GLP-1 receptor agonists. Okay, all these things, and dual incretin therapies. And what is new in the research or update in field of diabetes. All these things will be discussed. Then in the module 6, insulin and insulin delivery devices, because it is very important. If you have a type 1 diabetic patient, you must know that what are the insulin pumps, pen devices, pumps, continuous infusion system, what are those. That is also equally important, even for your practice and for your clinical and theoretical exams as well. Okay, so module 6 will be about the insulin, everything will be there. Then the module 7 will be about the complications and the how to prevent or treat those complications. Okay, then module 8 will be about the further complications and the follow-up protocols, that what things we have to take care while managing these patients. And then will be the ninth module, in which I've added all the cases scenarios. Okay, case scenarios. Okay, in the module 9 there will be case scenarios, right? So please now note, these are very, very important dates. See, the class is going to launch at 7th November. In the website you will not see any video till 7th November, and I have added that so that there is an anticipation about the course. Okay, so till like 7th November people will register. Okay, otherwise it just goes like, okay, aega dekh lenge. So I don't want like that. Okay, so that's why, to create little hype about this, I've created a launch at 7th November. Okay, few lectures, like 1 or 2 lectures at the end are left, so that's why that will also be completed by that time. And the complete entire videos, 9 videos with questions, everything will be launched by this date, that 7th November. Okay, then about the early bird registration, that will end at 5th November. Okay, early bird, we are costing it at around rupees 1399. Okay, this is the wrong. Okay, 1399. Okay, and the MRP is around 2000. Okay, so we are giving already 40% discount we are giving. Okay, so that will be live till 5th November. I will extend that depending on the students' response as well and requests. Okay, but make sure the course launch date is 7th November. There is no negotiation about that. Most importantly, there is a World Diabetes Day on the 14th of the November. So before that, we will have our first session on 12th November about the weekly session that I maintain. Once you pay for the class and you become member of the Diabesity Academy, every week there will be one live session on every Wednesday. Okay, and there will be live quiz and prizes on the 12th 22 November. As I mentioned, after 15 days of the class launch, there will be a live quiz and the prizes. Okay, for top 5 people, right? So annual access will be at rupees 1399, all 9 modules, 20 to 25 MCQs, and 6-month weekly live sessions plus certificate. If you want lifetime access. Okay, it is, we are costing it at rupees 3000 rupees. I think in both the cases it is pretty much affordable for you. Okay, ज़्यादा से ज़्यादा क्या है, दो तीन बार मतलब एक डिनर you have to avoid outside. Okay, or avoid getting subscription or any favorite platform, or maybe avoid getting going to movies of your favorite star. Okay, that's all is required to make that significant difference in your clinical practice, just to make a positive impact. You will feel better, and that's my confidence. Okay, right. Then coming to the rewards, as I mentioned, the quiz winners will be winning Littmann stethoscope, medtech gadgets, etc., CGM devices up to rupees 50,000. Top 20 performance, we can directly get into the online diabetes clinic, as I already mentioned, and all participants will get certificates, AI software access, and the digital badge, which they can use for their practice about the ACPD scores. Okay, right? So be prepared. Okay, the course is going to launch at 7th November. Right now you will just purchase and wait till 7th November, then you can access the course. Then after this course, we have the obesity masterclass also planned, because diabesity means diabetes plus obesity is there. But as a member of the class, you have already purchased this and you are already member of the Diabesity Academy. Okay, you will get additional 30% discount on whatever price we will keep for the obesity masterclass also. Okay, that will be just exclusive for you. All right, so now I will just quickly show you how to do the payment. Okay, so let's go into the super profile. Okay, second, I'll have to go in the incognito tab now. I'll have to go into the new incognito tab. Let's go to the I'll now copy that link. Okay, 1 second. Okay, so now here is the link. I've uploaded that link. This is how it will appear. Okay, 9 in-depth session, 1 year course access at rupees 1399. You have to just click the enroll now. Here, whatever I told you is given in writing over there. Okay, it's given in writing over there, whatever we just discussed. Okay, all the modules, the details, everything is there, dates and all those things are there. You can just check. This is my brief bio over there. These are the lessons, all are locked. This first session will be available free. Okay, so I'll add this under the lesson 1 only, module 1 only. You can watch that for free because it is just an introduction video. Okay, then you will learn whatever things we discuss, that will be there. And these are some of the testimonials, and we have few Q&As as well, which you can access. Okay, so these are all your Q&As. When will be the session live or recorded, how long will I get the access, etc. Okay, can I share this with the others? No, absolutely not. All right, are lectures available for download? So lectures are not available for downloads, you have to watch it online, but notes can you can download. Okay, so you can additionally add this daily Harrison's 22nd edition class also. The cost is rupees 9,000 for that, because that happens, the daily class is there. Okay, so if you have any query, you just have to WhatsApp 75883545 number. Okay, I hope we are clear with this. Or you can email me at drgabalevishal@gmail.com. Okay, right. So this is how the course introduction is, and I'll be sharing one more video where I'll be teaching about the cases and diabetes also. Okay, so I hope you understood the entire thing. I hope you are equally excited as I am for the advanced certificate in practical diabetology. Please promote this, thinking as be part of our own team, and help your friends if they are interested in learning diabetology, or they want to just brush up their concepts about the diabetes. All right, so because I am working hard to create these 8 modules, but additionally I'm giving you one weekly session as well. Okay, which is just a special one. I mean, where we will talk about the case presentation. You can also present cases. We'll discuss about the updates. We'll discuss about whatever the recent news in the diabetology, because that's the field of my interest as well. Okay, so thank you so much, guys. If you want, if you're interested, just you can see the link in the description box as well, or if you're already on the super profile website, please don't waste any more time, because early bird offer is for a limited time. Thank you guys, thank you so much.